My name is Nicole. I'm a psychology major in my final year at UCSD. I didn't end up in psychology because it was easy, or because I didn't know what else to do. I've always been interested in mental health. This quarter I'm taking a class on rhetoric and new media. In this video I'm exploring the unintended consequences of the proliferation of new media from a mental health perspective. New media is amazing in a lot of ways, and there are a number of useful applications in several areas of our lives. But there is a sinister side as well. Some people develop pathological relationships with the internet. There are several names for this behavior, including internet overuse, problematic computer use, pathological computing, and internet addictive disorder, or IAD. Defining and distinguishing disorders is a sticky business. In the field of psychology, there is a manual that practitioners use as a tool to guide their diagnoses. The Diagnostic and Statistical Manual of Mental Disorders is abbreviated DSM-4-TR because we are currently using the text revision of the 4th edition. The DSM uses descriptions of symptom clusters to establish how problems of behavior, thought, and affect manifest themselves. Many years of training and experience, along with ample time spent with the patient, are required to make a good diagnosis. At its worst, diagnosis is a hasty label that can damage a patient's self-esteem and future prognosis. At its best, diagnosis is used to guide useful and relevant treatments. There is no internet addictive disorder in the DSM-4-TR, but it is proposed for inclusion in the DSM-5. Proposed diagnostic criteria include: 1. Is preoccupied with the internet. Thinks about previous online activity or anticipates next online session. 2. Needs to use the internet with increased amounts of time in order to achieve satisfaction. 3. Has made unsuccessful effort to control, cut back, or stop internet use. 4. Is restless, moody, depressed, or irritable when attempting to cut down or stop internet use. 5. Has stayed online longer than originally intended. 6. Has jeopardized or risked the loss of a significant relationship, job, educational, or career opportunity. 7. Has lied to family members, therapists, or others to conceal the extent of involvement with the internet. 8. Uses the internet as a way of escaping from problems or of relieving a dysphoric mood, for example, feelings of helplessness, guilt, anxiety, or depression. In order to receive a diagnosis of internet addictive disorder, the patient must have all of the first 5 symptoms and at least one of the last 3 symptoms. As with all DSM disorders, there needs to be significant functional and psychosocial impairments. These symptoms and impairments need to have been present for at least 3 months, with at least 6 hours of non-essential internet usage per day. It is important to be sure that the excessive internet use is not due to psychotic or other disorders. The above criteria are modified from the pathological gambling criteria in the DSM-4. Pathological internet use is similar to other behavioral or procedural addictions, like gambling, shopping, and sex. The difference is that IAD is uniquely isolating and non-social compared to going to the casino or racetrack. It's also more difficult to treat because, like anorexia, the patient has to learn to moderate their compulsive behavior. It is impossible to abstain completely from food, and it will be hard and almost impossible to abstain completely from computing as well. IAD often co-occurs with other disorders like depression, anxiety, and attention deficit disorder. The isolating effects of compulsive computer usage can prolong rehabilitation from other disorders. Younger people are at a higher risk for this disorder. Males with ADHD or high hostility are at a higher risk of developing a pathological relationship with the internet. Females with depression or social anxiety disorders are also at high risk for developing internet addictive disorder. Much like smoking cigarettes, the development of a full-blown internet addiction is insidious and takes time. Many people begin smoking only when they are drinking. Then they buy their own pack, but only on weekends or during finals. Eventually they're smoking a pack a day, and need to, in order to feel normal. The progression for internet addictive disorder occurs along similar lines. If someone can recognize that they are at high risk earlier in the progression, they can take steps to mitigate a full-blown addiction. They could work on limiting their time on the internet while also making a point of developing offline social networks. Some people use timers to turn off their computers after a predetermined amount of time. It is estimated that 10% of the U.S. population uses new media compulsively, and at the detriment of their grades, families, jobs, health, and even lives. In 2005, a South Korean man died of cardiac arrest after playing over 50 straight hours of StarCraft. In 2009, a young couple in South Korea neglected their new baby to the point of starvation and death. In 2010, a Florida woman shook her baby to death after the baby's crying distracted her from her Farmville game. These are just a few of the most extreme consequences of internet addictive disorder. There are a plethora of people experiencing less severe consequences every day. With this incredible influx of new media comes responsibility. Our society needs to increase education and awareness about internet addictive disorder, particularly with young people. While new media provides most people with entertainment and opportunities, there are unintended consequences. How severe does this epidemic have to become before collective action will be taken?